to the show. We're going to be doing a coronavirus update. Should be an excellent show. Information on what's going on locally, nationally, internationally. Invite your friends. Share this out.
Welcome, everyone, to A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, KPPPLP, Fargo, Moorhead, where we are adding local color to your airwaves. Today, in this second week of August, we are going to give you an update on where we are with the pandemic, the global pandemic that has been hitting the United States especially hard. By that I mean we have not been able to flatten our curve. We have not been able to control the number of people that are getting sick. And in the Midwest, we are starting to see numbers climbing at an alarming rate. Meanwhile, we have states like Florida, Texas, and Georgia, and even New York starting to spike up again. So we're going to talk about all of that, what's going on with school reopenings, what happened after Sturgis, on today's program here on A Mexican Crossing Lines. Now, at the risk of inviting more hate calls on our phone-in line that we've had today, I am going to ask you, Duke, to tell people how they can call and leave a message for the radio station and support the work of this nonprofit, low-power FM station.
Well, thank you. And thank you for joining us tonight. As Cindy said, you go to 701-566-0917. That's 701-566-0917. That's a message line, basically, and you can call and leave a message up to 3 minutes or so. Also, you can get a hold of us by email. You can send an email to Cindy at kpppfm.com or me, Duke, at kpppfm.com. Also, go to Facebook at 88.1 FM Fargo Moorhead. We're streaming right there, and you can go to Duke 1517 on YouTube. We're multi-streaming on Facebook and YouTube. You can also go to kpppfm.com, look around at our old shows, look at shows that have been live streamed, shows that have been on the air, our different programming. And also, if you'd like to make a tax-deductible contribution, go to kpppfm.com/donate. Make a tax-deductible donation to help our station grow and continue to produce media, continue to produce things in the community that people are involved in, our live streaming, our shows, our radio shows, all the things we do. We appreciate your support, and we appreciate all of you who have been supporting us through these years.
Some people are questioning me about the comment I made about the hate mail. Let me elaborate on what that means. Sherry, your question about the hate calls, it's not just calls, it's posts, it's tweets, it's messages, and some form of dogpiling on our page because of my recent reporting about Tawasi, no last name, Sose, about the arrest for the attack on federal law enforcement officers and doxing of law enforcement. No word on whether or not that was improper. In fact, Tawasi wasn't upset at all about any of that. They were upset about the comments that I made about them being a poor representative for Native people. And there's a lot of people that can fill that void where Native American issues and Native American people need to be represented. A lot of them are white passing, even if they are some quantum of Native American. And I don't think, this is my personal opinion, I don't think they should be centering themselves, especially when they come from a background where they haven't been raised in any kind of tradition of Native American culture, such that they actually do more harm in being the representative of Native American issues than they do in helping. And that is my opinion to have, and I will continue to have it. I will also continue to feature more pretendians, more people that I feel that are sellouts, that are occupying a space and speaking on behalf of people they have no business representing. So, for those of the people out there that are still sending in their comments and their angry messages, their hate-filled messages about my reporting, I didn't get the part where you got arrested wrong. I didn't get that part wrong. The only thing that's in dispute here is whether or not my opinion of whether you are a good representative for Native Americans is at play. And you're welcome to your opinions. I'm also welcome to mine. So without further ado, let's talk about what's happening with the pandemic. Okay? Let's look at the world numbers first. The world numbers are updating on mine. So I have 21,991,954 cases of COVID. 21 million.
Wow.
That is a lot. Wow. Global deaths sit right now at 777,018. And the U.S. is leading in deaths right now at 171,679. Followed by Brazil at 108,536, followed by Mexico. Mexico is hitting the 60,000 people mark.
Wow.
And internally, I'm hearing from folks that are in Mexico saying they believe those numbers to be higher.
I see.
They don't believe that the states and that the health officials and the government are being transparent and open and honest about the number of deaths and the number of illnesses. In India, they have hit 51,797 deaths, and the UK trails behind India at 41,466 deaths. So, incredibly, Russia, though they are number 4 in numbers of infected cases, they are not even in the top 5 of countries with the most deaths. They're like 12. They're, let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9. They're 10 countries down on the list of deaths after Peru, Spain, and Iran, after Italy, after France, after the UK, after India. So even though they have 930,276 cases, they have a lot less deaths. And by the way, remember, Russia now has a vaccine. Russia has also been accused of stealing information, of hacking information from American researchers in order to fast track and produce that vaccine ahead of anyone else. What are they calling their vaccine, Duke?
The Sputnik 5.
The Sputnik 5. How effective do you think this vaccine is? Does it give Russia the edge? What does this mean that they have a vaccine not only before the United States, but before anyone in the world?
I don't know, because hasn't really been tested. That's part of the whole thing, is there's not enough transparency for the rest of the world to be in on their innovation. Even the ones that they're talking about that U.S. companies are being paid billions of dollars for, they're talking at 50% effective. Some maybe higher, but they're not going to be 95% effective or 100% effective. So that means a bunch of people still going to get sick. They're not going to work. So it's for Russia to come out early with for me, I don't know. It's just kind of like the space race. First one in space, first one to have a vaccine. Is it just bragging rights, or is it a multi-trillion-dollar money investments that are going to come to Russia for them to get rich, basically? I don't know.
I think they could be. I mean, let's say for argument's sake you're right, and then it's only 50% effective. There's still a vaccine that is 50% effective.
Yeah.
So that definitely gives them the edge, and I'm sure they're going to continue developing more vaccine. Their research doesn't end just because they've got a vaccine out and they're already mass producing it and they're already giving it to people.
Mm-hmm.
What it does do, even if the vaccine is not 100% effective, even if it's only 50% effective, is it gives them a huge head start over the United States, over the UK, over China, over everyone else. And it's a big head start. I'm talking about the United States not having a vaccine that it is mass producing until 2021, really. I mean, they talked about the fact that we're probably going to have a vaccine available by the end of the year, but ramped up where it's mass produced and people are getting it en masse, I think we're not going to see that until 2021. So that could mean that Russia, in terms of their workforce, their economy, could be out in front of this race.
Yep, maybe.
Far, far ahead of every other.
More of an economic power,
Yes. I mean, I don't know what this means for the globe, but it does mean something significant. Here in the U.S., our cases are up to 5,653,520. We've had 174,000 deaths, 174,951 to be exact. 3,008,723 people have recovered.
I think it's interesting. Like, you put these numbers down about an hour ago or 2 hours ago, and they went up 10,000 people in the United States just in an hour.
And so looking at the states, it's very different. New York was on top of the leaderboard in terms of cases and in terms of deaths. And California, of course, was closely following. Now California is leading with a total of 640,357 cases, 173 new deaths. Florida is behind California at 579,932. And then behind Florida is Texas and New York and Georgia. The difference here, though, is that New York has 12 new deaths compared to California's 173 new deaths, Florida's 218 new deaths, Texas's 124 new deaths, and Georgia's 67 new deaths. And Minnesota and North Dakota, our numbers are really starting to increase.
Yeah, they're increasing. In North Dakota, they continually go up. In fact, 2 more people passed away in North Dakota today. A man in his hundreds in Grand Forks County with underlying health conditions, and a woman in her 80s from Burleigh County. North Dakota's had 128 deaths, and this is yesterday's stats. I always do a day behind. 128 deaths, the 2 I just mentioned, and total hospitalized is 469. Basically, in Cass County, there's 12 people. That number's a little bit lower that I've seen in our county. It's the biggest county in North Dakota, our neighbor to North Dakota. And then also, the overall numbers is that there are 180,000 people tested, and the total positives are 8,782 positive people in North Dakota. Now, their daily positivity rate went up quite a bit, 7.2 now, where it was like 1%. They've been bragging about being 1% forever, and 2%, but they're actually going up. Now, for Minnesota, there's a lot of deaths, it's like
60-some thousand.
Yeah, 66,107. And just on August 13th, there was 690 deaths, in one day in Minnesota.
Wow.
There's 1,767 deaths. And let's see, I guess I don't have the county on here. Thought I had the county, but we have like 40, almost 40 deaths and almost 800 cases in Clay County here.
There's a lot that is happening with regards to research about, the immune response and antibodies that we develop if you catch COVID-19. And we don't have clear information on the immunity that is provided to people following contracting COVID. But what little information we have does have a silver lining. Duke, your sister commented that one of her friends just found out that they had COVID and they had antibodies for COVID. So they must have had COVID at some point. They didn't know it. Mm-hmm. And that doesn't mean, they were told by their doctor, that doesn't mean they can't catch it. They're not immune. But what we do know is that there is some form of immune response. A recent batch of studies, many in their early stages and not yet peer-reviewed, show that humans have a robust immune response to COVID-19 that may protect them from further infection, even if they only had mild symptoms. How long that protection lasts is still unclear, but the studies do indicate that it can last for months, even in cases where people had very mild symptoms. They are expected to have some kind of immunity from catching the disease again for at least 3 months. That is what they believe right now. One leading immunologist says the findings provided optimism that people will not have to endure repeated coronavirus infections. It also provides evidence a vaccine might protect people for more than just a short time. So that's hopeful news, right, Duke?
Mm-hmm.
And we need some hopeful news with regard to this pandemic because there's a lot of people that are they're tired of it. They're over it.
Well, it's really hard, and we've been going through this since, March, staying at home and doing all these things. At some point you feel like, what? Do I have to keep on doing this? And the answer is yes, for a long time. And it's really hard to grapple with that. Life has changed. You don't be able to physically see people. People are just kind of going crazy. They're just going to drive around. They're going to go into crowds. They're just going to get their freak on doing that sort of stuff. And it's like, that's the stuff that spreads the disease. It's because of those people, and other people just don't care that this disease continually spreads, and we can do things about that. We can just take the precautions, and just for a short time. If we all did it, it'd be so much shorter. But we're in it for the long haul, and we're going to be having to do this for a long time. Even
in situations where people are able to be outside and have a reasonable distance from each other. For example, recently, South Dakota hosted the largest mass gathering of people since the pandemic started at Sturgis. And there has already been a patron of a saloon, a famous saloon there called One-Eyed Jack's Saloon, that has tested positive for COVID-19. This according to the South Dakota Department of Health. The individual that contracted COVID-19 and was transmitting that virus to other people, visited One-Eyed Jack's Saloon, between August 11th, between 12 p.m. and 5:30 p.m. So,
whole afternoon, huh?
from 12 to 5:30 p.m. on August 11th, if you were at the One-Eyed Jack Saloon at 1304 Main Street in Sturgis, you are asked by the Department of Health of South Dakota to check yourself to monitor yourself for symptoms for 14 days and to quarantine yourself. So, in addition to all the things that you're doing normally, washing your hands, social distancing, covering your coughs and your sneezes, avoiding close contact with people, especially that have symptoms or are sick, refrain from touching your eyes and your nose and your mouth, frequently cleaning surfaces and objects. You also, if you visited Sturgis and went to this bar, need to quarantine and check yourself for symptoms because you may have come into contact with somebody that has now tested positive for COVID. I haven't heard of a lot of people saying that they are starting to see symptomatic people or, sick people coming back from Sturgis other than this story.
And it's really hard to trace.
Do you think it's going to have a big impact?
Well,
I mean, most of them were outside.
Well, and it's happened. There's been protests and there's been gatherings and, people have come in contact and some people haven't, and it's really hard to measure. And also, for someone just to have the marching orders, if you were in the saloon between 12:30 and 5 on that day, you're supposed to do these things. It's like a bunch of people won't. They just won't do it. They might come down and get sick, or they might just spread the virus around, or they might not get sick at all. And if it's up to people just to do the right thing, it just isn't going to happen, in my opinion.
Well, here's the thing. Here in Minnesota, for example, we have had declining numbers.
Yeah.
And according to the Star Tribune's article, that these declining case numbers coincide with the mask mandate in the state of Minnesota. Minnesota's second COVID wave of this pandemic is showing signs of finally leveling off, with 359 lab-confirmed infections reported on Tuesday with the novel coronavirus that caused infectious diseases. While daily numbers reported on Tuesday have typically been lower, reflecting reduced testing and diagnostic activity on weekends, that is one of the lowest number that they've had in weeks. The average daily case count had been more than 700 in late July and early August, but has now dropped below that mark. The timing, at least, coincides with the state indoor mask-wearing mandate that took effect on July 25. But because it often, takes 2 to 4 weeks before you see any public health strategies or major events to show up in case numbers, we haven't really been able to tell whether it's helping or not. State Health Commissioner Jan Malcolm said that there is actually no way to prove if the mask mandate made a difference, though. Quote, "It's often really hard, if not impossible, to pin down precisely which interventions had which percentage of effect," Malcolm said. But certainly the fact that we've seen a stabilization in our cases and even a trend downward certainly coincides in time with what we would expect to see from this mask mandate. So the question is, are you comfortable doing it or not? Are you gonna wear a mask? Are you not gonna wear a mask?
Sure, do it. Yeah, what do you got to lose? Just do it. Just safely.
You're going to definitely do it because you got to protect me, and I'm immunocompromised.
And I'm just not going anywhere. But I bring a mask when I do go someplace, when I go in my car, when I walk around the block, I bring a mask along, and I'll wear a mask immediately when I see a person. But, being indoors, I don't want to go indoors anywhere, so I'll definitely wear a mask.
And, for those who have an immunocompromised person at home, for those who have an underlying condition, or someone that's an elderly or that has underlying conditions that lives in their home, this pandemic is far from over. We have to be on high alert, and we have to continue to protect our family members and protect ourselves. Before a lot of other folks, things are going back to normal, or our new normal.
Our new normal.
With businesses, of course, opening, schools reopening, and with the spikes that are expected to hit Minnesota in the coming weeks, there has been a new shortage of masks here.
Great.
Yes. This, according to this article, says that with second virus wave coming, Minnesota waits for millions of N95 masks. They've been ordered, but getting them into the state is another story.
Wow.
So, according to this article, so far about 337,000 of these N95 masks have been delivered to the state stockpile since March, while orders from more than 5 million more are still awaiting delivery. A review of the state's purchasing shows that masks will arrive in batches over the next year and a half.
What?
Some may never arrive at all.
Oh, great.
So this is a make sure we're turning over every stone approach, said Wayne Wozlaski, project manager from the Minnesota Department of Public Safety's critical care supply team. The normal supply chain isn't working. Wow. In a topsy-turvy global mask market, the Minnesota Department of Health warehouse in St. Paul has been able to secure just 3 batches of more than 100,000 medical-grade infection-preventing N95 masks since March, including 2 made by Maplewood-based 3M company.
Yeah.
These state stockpile masks serve as a backup supply for hospitals, which have about 745,000 N95 masks in storage today, state data shows. For contrast, Minnesota hospitals consume about 9,000 medical-grade N95 masks per day.
Wow.
So that, of course, is the reason why we have so many of our medical staff reusing masks, which is against their training, but is a requirement because of the shortage that we have. So, folks, the need for N95 masks for our medical community has not changed. It has not gone away. It is still a problem. Incidentally, the president just visited Mankato, Minnesota just yesterday.
Yeah.
And I hope that the president helps the states get masks. Maybe there is a need now to invoke that, what's it called? The
Powers Act, whatever.
The Powers Act that allows him to make factories into whatever he wants them to be. I think it's definitely something that the medical personnel in every state need to have access to, especially as our numbers are starting to climb here in the state of Minnesota. But for restaurants, for other businesses, mask mandates may not be their cup of tea. Take a look at the story from northern Minnesota, where the Iron Waffle business has opted for optional masks. They have a sign in their door, on their door, telling patrons that, you know what, if you want to wear a mask, that's great. If you don't want to wear a mask, that's also fine. And they make it optional for you to go into their business. You don't have to go inside their business. If you don't want to go inside of a business where possibly other customers will be eating without masks on, you don't have to go in there. You don't have to get waffles and coffee at this particular business. You can go somewhere else. Also, you should know that they do not consider themselves to be an essential business. This is not like going into a Costco or a pharmacy or a Walmart. I mean, I can understand why those businesses, many of which have pharmacies attached, which are essential businesses because you have to get food and supplies like medicine and things like that, would have to have mask mandates because there are people that have underlying medical conditions that make it more risky for them to get this disease and die from it. But a waffle place is not that big of a deal. So the business owner, Jeremiah Duvall, says, you don't have to come in. You don't want to go in? You don't have to. They have been doing business for the last 5 years at this particular place, and they feel like people should have the freedom to choose whether or not they have to wear masks. 2 Minneapolis visitors to the restaurant were interviewed by Fox 9 News, and this is what they had to say about this Waffle House. I understand the position, but I also think in times like this, it's not about that, about freedom, meaning about freedom. It's more about the health of others. It's caring about what's happening with other people and not just yourself. Duke?
Exactly. That's what, that's part of the whole thing there with when people are deciding for themselves, they're going to put other people in danger. And we've talked about it before, and it's like you are potentially hurting other people by your action because you just don't want to participate in this. It's a free country and all that stuff. And then people are doing that. They're walking in places without masks. They're getting in hassles with people. People are trying to enforce the rules. We have a mask mandate indoors right now in Minnesota. And it's like, it's for a purpose, and when you decide you're just going to take it in your own hands and, screw everybody else, the things you can cause, it's very irresponsible and it's not being a very good community member.
Well, here's what the Minnesota Department of Health had to say, because they've sent this and only 2 other businesses a cease and desist letter that they have to follow the mask mandates in the state so as not to cause a health risk. Mm-hmm. Because you're violating health department, regulations.
Yeah.
And this is what they said. Just like food safety requirements are not optional, these COVID safety requirements are not optional. This according to Chris Erzman, the infectious disease director at the Minnesota Department of Health. Stacy Strawn, one of the co-owners, said, I don't want to get thrown into jail, but I don't want to back down. Duvall, one of the owners, said that their part-time staff of 7 is completely on board with it. They're all fine with this being mask optional. So the customers are okay with it. The staff is okay with it. And the owners are okay with it. Do you think that they should get thrown in the who's gal if they don't follow the mask orders? Everybody seems to be okay with it. Should they have the right to do that?
It's the thing again. I think they should be fined. I think they should have some sort of penalty. Because people they need something like that because they're not going to do it on their own. So it's really a hassle have our law enforcement or government to be out there, policing, mass policing sort of thing. But people have to quit doing this. Aren't they looking at the numbers? We showed numbers tonight. We haven't been doing numbers for a couple of weeks.
Well,
the numbers have went up. They keep on going up and up.
This is what the owners have said, Duke. They are going to stand their ground no matter what happens. In fact, if they're forced to follow the mask mandate, they said they would probably close their restaurant for the rest of the season and wait for the state to stop overstepping their powers.
Well, it's a weird threat. I'm going to close down and not make any money and not have a business if you don't do this. It's like, well, go ahead.
This is going to happen.
Just do it. If you violate the rules, and you lose your license to be able to do your business, and you want that to happen, go ahead.
So now let's talk about schools, because schools are reopening. Some schools are already having spikes in cases. Some schools are having to close down. And then, of course, there is the, just kind of discombobulated way in which schools are being reopened. Some of them are reopening to full, in-person learning. Some of them are doing partial in-person learning, partial stay-at-home learning. Some of them are doing all stay-at-home learning. And the way in which they decide what percentage of what they're going to use on any given day is kind of up in the air. At least it is here in Minnesota, North Dakota on the border, where we have West Fargo, and Moorhead chiming in on how they're going to do things, and everyone is doing it different. I just wanted to give you a little taste of what that sounds like from a panel discussion on 630 Point of View with Chris Berg. And I wanted to share with you a clip of his discussion with the superintendent of schools of Fargo, West Fargo, and Moorhead. The Moorhead superintendent is speaking here about how they decide what percentage of in-person, at home, and how cases of COVID are going to affect that. Take a listen.
Our plan that the state has designed for us that's based on our county metrics. So what I would say to that is the metrics are based on 0 to 9 would be in-person learning, 10 to 20 would be an elementary hybrid, no elementary in-person, secondary hybrid, 10 to 20, that was 10 to 20, 20 to 30 would be elementary hybrid, secondary hybrid, and then 30 to 49 would be elementary hybrid, secondary distance, and then 50 plus would be anything 50 plus would be our district would be in distance learning. So we have a pretty tight rubric in which we have to follow.
Yeah. Well, and I apologize. That was a lot of numbers. What's the 50 plus thing?
50 plus means, Chris, that the district would be case counts anything over 50, and we get those numbers on a weekly basis. That would push our district into a distance learning model, K through 12.
So total population of your district, if you hit 50 cases, that means that you now are totally distance learning. Am I hearing that correctly?
No, it's just 50 plus, and so how that is calculated, we take the total number of cases for 14 days and divided. Our county population is divided by 10,000. You take those cases, total number of cases for 14 days, and divide that out, and that gives you that number that we're talking about.
So this might sound like a really ignorant question, but how in the world did you come up with that formula, and how does it make any sense to determine this?
Well, I can honestly tell you, we didn't come up with the formula. The Minnesota Department of Health came up with that formula. And as part of our return to learn plan, we have to implement that and follow that rubric in regards to where we're at as a district and as a county. So, you know, from my perspective, I like the rubric. I like the fact that it gives us clear guidance on where we need to be. And it encourages our county to take the mitigation strategies seriously so we can ultimately get our kids back into school face to face. So I believe I support of the metric.
Okay. Dr. Gandhi, let's go to you. What's the measurement? And maybe it's going to be the same if it's going to be dictated by the state. I don't know if it is or not, but for Dr. Gandhi, maybe for Beth, what's the metric to say, okay, now we can bring our kids back to school full time?
Sure. So for at least for Fargo, and I think in the state of North Dakota, we have not been given any certain metrics or thresholds to be utilized at the state level for all K-12 school systems to use. It's really been made as to a local decision. So the process that we put in place is that we put together a committee, what we call the Fargo Public Schools Instructional Plan Committee, and they are composed of a wide variety of stakeholders, including parents, teachers, a board member, and central office administrators. And what they will do is they will meet every 2 weeks with Fargo Cass Public Health and an epidemiologist from Fargo Cass Public Health to look at a 14-day rolling average and then determine what instructional plan or instructional model should we be utilizing in our school district. Now, the committees met once, and when they met, they did determine that we would be opening in the hybrid level 3 scenario for both elementary and secondary schools. But what the committee also decided is that moving forward, they do want to work towards looking at either the Minnesota model or other models and determining specific thresholds that we can use to guide our decision making moving forward.
And again, I guess what I'm struggling with, guys.
Boy, I'm struggling too.
Can you do that math?
I'm like sitting there like, what are they trying to do? They're trying to push off and like not closing is what they're trying to do. So they got to make this formula that makes it so you multiply 10,000 by 14 by 8 days and this and that, and throw in a few pennies and throw in some dice. If you get 2 snake eyes, you win. Keep on going, It's like, what are they doing?
I don't know, but I was watching Chris Berg's eyes, and it was just like that slow blinking he was doing, like, what is this guy talking about?
I know.
And the funniest thing was that the superintendent goes, look, I don't know who made up this rubric. I have no idea who made it up.
That's right.
I didn't do it, but I like it. I like it because it gives me something. It gives me a formula, like it's like a potion or something, like some magic math,
Just mix it in, and when it goes clear, you're good.
And then of course they go over to Fargo and they're like, "Hey, what do you think?" And Fargo's like, "Yeah, we don't have any guidance whatsoever, but we're looking at Moorhead and we're going, maybe we'll do that."
Yeah, we'll just throw the stuff in the box and shake it around, and like Moorhead does.
Oh my gosh. I think that one of the most important things they should be doing is checking in with teachers. Checking in with teachers, checking in with schools, and, checking in with the superintendents, of course. They're the people that are doing the jobs. They're the teachers that we so have appreciated, especially during this pandemic, because we've learned how important teachers are and in the lives of our children. And we're going to have to adapt. We're going through a global pandemic, folks, so we got to adapt and figure out how to do this and how to do right by our children and how to make sure we educate them. But we have to listen to our teachers, I think. This arbitrary formulation of numbers sounds like a recipe for disaster. I don't know how to come up with a good plan for what percentage of distance learning and what percentage of in-person learning you do, or how they do that. I mean, I even heard of a school where they were having the kids come in for in-person learning, and then there was another group of students that came in.
It was batches.
In batches, right?
Monday, Tuesday, skip Wednesday, Thursday, Friday,
But instead of doing that, they should have probably done a day where they did the distance learning in between, so they had more time to clean the schools. Mm-hmm. And, I guess if everyone is going to do it different, because every school is different, every state is different, every town is different, every community has a different amount of cases of COVID. And so it's all up in the air how we're going to reopen our schools safely. But so far, it's very kind of fly by the seat of your pants. Make it up as you go along here in the Fargo-Moorhead region.
For sure.
And we'll continue to monitor how that is going as schools prepare to open in the month of September. I will be praying for all of our teachers. I will be praying for all of our medical workers. And I will be praying for the people of the United States so that we can get past this pandemic and begin to live life again post-pandemic. I'm looking forward to that. Are you?
Yeah, me too. Me too. Like if it ever happens.
It's going to happen. It's definitely going to happen. It's just not going to happen today.
Yep.
But we will continue to bring you updates on what is going on with this global pandemic here on A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, KPPPLP Fargo-Moorhead, where we are adding local color to your airwaves. Have a great evening and God bless.